Traditionally, thyroid cancer patients end up with total thyroidectomy plus or minus radioactive iodine ablation to zap every molecule of thyroid tissue in their body. And then the follow-up involves measurement of a protein called thyroglobulin, which is secreted by thyroid cells. And so if the patient has a recurrence of thyroid cancer, we can detect it by measuring thyroglobulin at a microscopic level. The problem that we face is somebody has a unilateral thyroid resection for a small cancer, but you still have the other side of the thyroid in there. You can't really measure thyroglobulin because it's really all the cancer detection is being overwhelmed by the normal thyroid tissue in there. So thyroglobulin is not a good biomarker. Clinicians are uncomfortable with this and have been for decades. And so at Baylor, we are currently evaluating the utility of looking at circulating tumor DNA of the actual cancer itself. That allows us to just look specifically for cancer cell recurrence in patients who have their normal native thyroid tissue still functioning and still doing well within them. And we're currently prospectively looking at that and employing that in our survivorship for thyroid cancer patients.
Does that enable you to determine if a patient is having a recurrence before it's visible on ultrasound?
That's the theory. And again, we're looking to see whether that's really the case or not, but we are employing it. It's in full production, and that's the theory.
Circulating tumor DNA has been used in other cancers as well. It's not a new idea, but it's new in terms of actually being put into clinical practice. And it's been in the research world for quite a while, but only recently within the last few years has there ever been a commercially viable test for circulating tumor DNA. I would say in the thyroid it is still somewhat in the experimental level. We don't have a lot of good data to see how well this actually works yet, but theoretically it should work quite well. And RFA on papillary thyroid cancers is the exact use case for why you would want circulating tumor DNA for thyroid cancer.